Morning, this is Dr. McDaniel. Today is Thursday, May 30th, and as the title indicates, I'm speaking about endometriosis today. Now, endometriosis is considered a disease or disorder where the lining inside the uterus, which we call the endometrium, the endometrium is scattered or dispersed microscopically and sometimes macroscopically throughout the pelvic abdominal cavity and sometimes throughout the body. Osis means to spread or to sprinkle, and endometrioma is a mass of that endometriotic tissue. Endometrium, which is the inner lining of the uterus. The purpose of that inner lining is to respond to your body's natural hormones. So it builds up the tissue or the blood layer to cause a menstrual cycle, and then after ovulation, the hormones are stimulated to clean out that lining if pregnancy doesn't occur. Now, if someone has abnormal presence of that endometrial tissue or endometrium elsewhere in the body, it too responds to the body's hormones. It builds up tissue or blood, and then it bleeds it out. Now, if this occurs outside of the uterus, naturally that's an abnormal environment, and liquid and blood outside of the lining inside the uterus, so anywhere else in the body, is an inflammatory agent. So it causes inflammation, pain, swelling, and eventually scarring. So endometriosis is a disease or a disorder where throughout the pelvic abdominal cavity and sometimes the rest of the body, cyclical or periodic, just as when the menstrual cycle occurs, cyclical or periodic inflammation, microscopic and sometimes macroscopic bleeding. So microscopic we can't see with the naked eye, but it's occurring, and macroscopic we can see it with the naked eye when it's occurring. It occurs throughout the body. Wherever this occurs outside of the uterus, it causes pain and over years scarring and dysfunction of the tissue where it occurs. Now, medically, we don't really know why some women have endometriosis and some women don't. We do know that it occurs in about 15 up to potentially 20% of the population. We don't really know why. We think that it's what we call retrograde menstruation phenomenon. So the menstrual cycle, when it occurs, instead of bleeding out through the cervix, it occurs retrograde, at least in some portion for some women, so it goes backwards. Most of it comes out through the cervix and vaginally, and some of it goes back through the fallopian tubes and into the pelvic cavity. Now, we know that that's not potentially the only mechanism by which endometriotic tissue can be seen or present outside of the uterus, because it has been noted that some women who have endometriosis will have it throughout areas of the body where retrograde menstruation or backwards menstruation could not reach it. So scientifically, on post-operative or post-mortem evaluation, endometriotic tissue has been seen in the lymph nodes, in thoracic cavities, so in the chest cavity, in lungs. That's a fairly common one outside of the pelvis and abdomen, in the liver, which is part of the abdomen, but in the lungs, even in the brain, in joints, and in the spinal column or the vertebral column, so the spiny back. So it has been seen even also like in the bladder, inside intestinal tissues or walls, so those are pelvic abdominal tissues. So it has been seen to spread locally and to spread distantly. Wherever it occurs, it can eventually cause dysfunction or upset the function of those organs, and wherever it occurs, it will cause pain and inflammatory tissue and scarring. The most common areas where endometriotic tissue has been noted has been around the ovaries, and that's thought because the fallopian tubes basically sit on top of the ovaries, so as it spills backwards out through the tubes, it dumps right on the ovaries. So on the ovaries, in front of the uterus, and behind the uterus. Microscopically, we can't see those tissue changes, but the woman who has that endometriotic abnormal tissue, or what we call endometriotic implants, she will have pain, most often debilitating pain, with her menstrual cycle. And as time goes on and years go on, that pain will become to exist outside of the menstrual cycle. So in general, we will say that someone most likely has endometriosis if she has menstrual pain that disrupts activities of daily living. So it's not normal for someone to miss school or work, to be doubled over in pain with their menstrual cycle where they can't function, bedridden, in a fetal position, and taking pain medicine doesn't help. So usually if someone has endometriosis, she's taking pain medicine around the clock with her menstrual cycle, and she still can't function. She's still in bed, doubled over. If someone takes pain medicine and they're able to function, they might have endometriosis, but it may just be that they're having bad menstrual cramps, so they need pain medicine to deal with it. So if pain medicine relieves the cramps, it's possible, but it's not as strong of a likelihood that that person has endometriosis. If pain medicine doesn't do anything, or if it barely touches it, it barely takes the edge off, they're still debilitated, then they most commonly and most assuredly have endometriotic implants in the pelvic abdominal tissue and potentially elsewhere. Now, if we can see the endometriotic tissues, we call those endometriotic implants. A lot of times they look like little brown, purple, sometimes almost black or golden yellow staining, or little bubbled stains or spots throughout the pelvic abdominal lining, and sometimes it can be seen on the organs in the pelvis and the abdomen. Sometimes you can see it penetrating through the wall of the bladder or through intestinal and rectal wall. For some women, occasionally it can be so severe it can penetrate through and cause scarring and contractions, so that the lumen, or the opening of the bladder or of the intestines or the rectum, gets smaller, so it's difficult to urinate or difficult to have bowel movements. And rarely, but it can happen, it can cause a hole or a fistula between different organs or different lumens. If it accumulates, we call it a cyst, an endometriotic cyst. And if it's larger than 3 centimeters, and 3 centimeters is about the size of a walnut, or a small plum, we'll call it an endometrioma. So I'm going to finish there today on endometriosis. I'll be back tomorrow. Tomorrow's Friday. I'll continue the talk on endometriosis. This is Dr. McDaniel. Thank you for watching this presentation. And please check out the YouTube channel. It's also called GYN Corner. If you're in the area, come on by. We're here in Manhattan, around the corner from Macy's and Penn Station, Midtown Manhattan. 35th, between 7th and 8th. The address is on this Facebook page. Come on by. We'll be happy to see you. We take walk-ins for problems. So for any kind of infection or pain or issue, we have walk-in hours every day. Just call the number on the Facebook page. We can see you for walk-ins. Thanks a lot. Have a great rest of the day. Bye.